This is Q&A with Prof. A, the Ibato kay Doc Bato educational series. The question thrown to us today is, what high-yield concepts should we know about hypernatremia? Always remember that serum sodium disorders are truly water imbalances. That for a serum sodium of 150 millimoles per liter, it does not mean that I gained 5 millimoles of sodium ions. Rather, I had a deficit of electrolyte-free water. Of course, the body has defense mechanisms to protect us from hypernatremia. Thirst is the primary defense for hypernatremia. If you have a patient with hypernatremia, it means that there is an impaired thirst mechanism commonly seen in the elderly or with patients with neurologic conditions like dementia, stroke, or brain tumors. Or there is an inability to express one's thirst, like normal newborns and infants and patients with depressed sensorium. You may have an intact thirst mechanism, or you can freely express your thirst, but with no access to drinking water, you can develop hypernatremia. People who are non-ambulant or even healthy survivors marooned in a place with no drinking water, like the desert or from rubble of a collapsed building, can develop hypernatremia. The second defense against hypernatremia is oliguria. The kidneys will conserve water to maintain normal serum sodium. So if you see a patient with hypernatremia and increase urine output, then consider a pathologic problem and it should warrant investigation. And thirdly, the brain will compensate from the increased serum sodium to maintain adequate water content of the brain. If the dehydration occurs for more than 24 hours, the brain will produce idiogenic osmolytes from glutamate, glutamine, and myoinositol. These osmolytes will balance osmolar content of the brain and the blood. However, these osmolytes will take a longer time to be degraded, unlike your sodium ions, such that if you suddenly decrease the serum sodium, the brain will still have a significant number of osmolytes that will avidly reabsorb water. This will lead to brain edema and herniation and even death. So in other words, if you are dehydrated, slowly drink water. That's why marathon runners or those who heavily sweat during intense activities will now drink small shots of water at regular intervals, such that their dehydration will not be rapidly corrected. And this will prevent sudden death from brain herniation due to brain edema. For more high-yield concepts, do not forget to click the subscribe button.